in our audience. Hopefully you had a good break and you had a fruitful discussion and networking. And we have a couple of panels ahead of us before we complete our first day of the summit. And it's my great pleasure to invite two speakers. They'll speak one after the other. Experienced volunteer organizations to provide medical care in pre-hospital care. And the first is Tata Margaryan, who is invited instructor on tactical medicine, NAEMT. Unfortunately, do not know how to correctly say it. Maybe not pronouncing it correctly. She is the commander of the team of medical evacuation Hospitaliers, very famous organization in Ukraine, helping to military servicemen since 2014 in the front line. They have saved numerous lives, and they're very much trusted by our society. And with their own example, they show how every person can be useful for Ukraine through undergoing tactical care, combat care courses. So Tata, the next 10 minutes is yours. So what is NEMT? So this is National Association Emergency, well, whatever, emergency care medics. Sorry, they were giving me the mic, so I'm distracted.
So much for tuning in and being here with us. Далі я продовжу українською.
Dear friends, I do not like this format too much. One person is just there and talking all the time. So if you have any comments or whatever, so would like to add something, so let us start the dialogue or discussion. So who am I and why I'm here? So I look about 18. Everyone tells me at least that I'm 18. I'm not. I'm Tata. I'm 26. And I work in the area of pre-medical care since 2018. I've started my pathway as an emergency responder together with the Red Cross, with the emergency team. And also I'm learning training in tactical casualty care, tactical medicine, combat medicine. And also I'm a member of Hospitaliers Medical Battalion. And first I worked in hospital number 66 military hospital. So my first rotation to provide care was there. And also I'm commander of our medical evacuation group. So first we worked in Kiev Oblast, then Kherson for 7 months. And then since it was liberated, we were working in the Donetsk area in Bakhmut stabilization station. So this is some of my background why I'm here. So who established our battalion is Yana Zinkevich. Maybe some of you know her. She founded Hospitalier organization in 2014 as part of the right sector. A round of applause, part of right sector. Yana is an incredible person. She inspires one of the most clever, structured people I've met in my life. It's my pleasure to work under her command. When she was 18, she created a battalion, and the Hospitaliers started to function on their own to support armed forces of Ukraine. And since that time, we never stopped. For our battalion, the war started basically 2014. As of today, you can see that Jan is in a wheelchair. But regardless of this injury or trauma, she is part of the Times 100 persons list, leaders, just as a wonderful representation of our nation. So where we are in Kiev, in Dnipro Oblast. So these are our stations. How do we work? We work by teams, evacuation teams. We have more than 60 evacuation teams, more than 300 or 400 volunteers, more than 400 evacuations, and more than 2,000 difficult to count how many saved lives. So many of them. So, but we haven't done any official, so to say, statistics. So let us stop at that. As long as we do not have a lot of time, we have limited time. I'll try to do it quickly. How do we work? Some people might have questions. We are volunteer battalion. What does that mean? So we are part of like Ministry of Defense. There is a special letter to say we have a memorandum of cooperation signed with the Ministry of Defense. We officially support the armed forces, but we are not part, so to say, of armed forces of Ukraine. We are not military unit.
And just to describe what we are doing and how, that would be the most important part. So let's imagine there is an injury to a rocket launcher, infantryman, gunner, whatever. And you're in the combat area and you get shot. What happens ever since? First of all, you either assist yourself or there will be somebody assisting you in the battlefield, following which the wounded serviceman has to be evacuated from the battlefield. Ideally, there is an armored vehicle coming to the field, collects the injured serviceman and takes it to the medical team. In Ukrainian realities, most probably first he will be evacuated, carried by hands, literally, for some distance. Later on, at the safe evacuation point, there would be a casual evac vehicle would be arriving, and such vehicle can be used is armored, and it can be used for different purposes, either supplying the ammunition to the battlefield location and evacuation of the servicemen as well as wounded ones from the battlefield. But ideally, this would be an armored vehicle. We at the Hospitaliers, we do have such armored vehicles, and that's what we call the caseback. They do not have any medical providers. They do not have any medical equipment. Some of them are better equipped than the others, but it's not a well-equipped medical evacuation vehicle. In any case, having evacuated the wounded soldier, this vehicle is taking it further away from the battlefield, handing over to the medical professionals, and that would be the time and place where I and my team will be stepping in. We have a non-armored resuscitation vehicle. Usually we have a medical team on board with either surgeon or resuscitation specialist, another health provider. We would have the ventilation device, oxygen supply, defibrillator on board. We also have other means for resuscitation and having intravenous or intraosseous access and infusions respectively. We also are equipped with coolers for blood products. We would have transfusion specialists or professionals trained in transfusions. So that's what we can do and how in terms of life-saving support up until reaching the stabilization point at the role, at the next stage of the role, or medical facility. So these would be some snapshots of our vehicles. This would be the exterior and interior. This would be my medical assistants, Andrei, and transfusiologist. So Andrei is providing concussion support, while the second member of the team is working with the bleeding. And now speaking of the Avstrika, which translates as the Austrian. This is an evacuation bus for 16 patients at a time. So this could be up to 8 prone patients or 16 sitting. This bus has a route from Pavlograd to Dmetro, and it evacuates severe cases which require more attention and closer life support interventions en route, and it commutes regularly. It actually commutes 24/7, there is no delay. every 2 weeks, the crew on board of such bus has its rotation, but we are trying to make sure that we are fully functional at any time of the day. And now, speaking of who the combat medics are, oh, wait a second, let me scroll back a couple of slides. Well, to start with, combat medic, this could be either male or female, no surprise with that. And important fact, we have not prevalence, definitely not dominance, but high representation of female providers in our battalion, and almost all of them have medical education. Before the war started, we would be happy to invite and accept any candidate even without medical education, but now this is one of eligibility criteria. Also, there are special courses for tactical medicines under the TCCC protocol of different levels, which is also a must, and we are also providers of such training. Also, we've been certified as an EMT center, so we have the quality certificates from international licensees. Also, speaking of the trainings provided, usually these are different courses, and again, depending on the scope and scale, combat lifesaver, that would be the highest possible rank of professional without any background education. Under the TCCC, this would be a 7-day-long course, which is delivered using mannequins, practice dolls, and different simulation and imitation devices, including those used in field settings, using different pyrotechnics and other environmental factors we are trying to use in order to provide the hands-on experience and stressors exposure to all of the students prior to them experiencing all of the above in the battlefield environment. Also, we have some special instructor training centers, and that's where we train the armed forces representatives. So all of the candidates enrolled to our battalion go through basic training, and then additionally to that, I believe it was a month ago that we started such courses for the civilians on BLS, Basic Life Support, and with that we are the 7th EMT certified center, and here you can see Michael Mayoli, who's the faculty member on EMT, who came to Ukraine to teach and provide for certification. So that would be the brief description of what our cadets are going through. So intravenous infusions are performed in real-life setting. So this is not just simulation. We're trying to make sure they get as much hands-on experience as possible, like waking them up in the middle of the night, making sure they are exercised well, and fully prepare for everything that they might have or be exposed to in the battlefield. So with that, I have covered the key facts, and I would like to hear some of your questions, because if there's nothing that you find interesting to inquire about, that means I have wasted my time and yours as well. In any case, if you have not generated any questions so far, please remember that I'm always here within reach over the course of our summit. Would you mind if I intervene with a question? Mr. Volodymyr mentioned earlier today that inappropriate choice of a tourniquet, either in terms of device or placement, might result in losing an extremity instead of saving the extremity and even life of your patient. So what do you think of when, how, and which tourniquet should be applied? Well, first of all, let's remember the basics. Before applying the tourniquet, tourniquet, we have to assess the wounded on account of critical hemorrhage, either pulsation and the stream of blood, traumatic amputation, or the blood spot, which is increasing in size right in front of you. So there are clear indications for applying the tourniquet. If such tourniquet was applied somewhere under fire, and indeed there was no time to perform bleeding assessment, then we teach our paramedics and medical assistants to reassess every patient when and if required. And in some cases, this is really a must, because you have to reassess as soon as possible and perform conversion of a tourniquet for a less traumatic bleeding control device, like, for example, hemostatic appliances, hemostatic bandages. So the tourniquet is released, and thus we continue with the evacuation of the wounded. Yes, sometimes it's difficult, although, to in making such a reassessment to understand whose blood that is, but in any case, this is important note to make. And, well, first of all, let me emphasize what a great job you are doing. So I'm saluting to you, but let me also ask for your opinion regarding hemodialysis in stabilization points. Let me also explain why I am asking this question. Last Friday, the 3rd Assault Platoon has refurbished one of their medevac vehicles into a hemodialysis laboratory on wheels. Well, let me explain something outright. I am not a medical professional. I'm not a clinician. I am a triage specialist, but I don't have any medical education as such. So, making any judgment regarding relevance or irrelevance in my case will not be the appropriate case scenario. But if you ask for my personal opinion, not as a medical professional, then I believe that, first of all, we have to abide by the clinical guidelines. And there was a reason for spelling out some rules and indications. If something is counterindicated, we should not interfere. If something is indicated, we should interfere, and there is no interpretation discretion as such. But let's indeed exchange some controversial ideas, but maybe in a side discussion. Excellent idea, but let's also agree that you will follow up with the results of your informal communication. So thank you, dear Tata. With that, inviting Dr. Gritsak, anesthesiologist from the Center of Life Salvation, which is the name of the charitable foundation.